So our next topic is spoilage and preservation of pharmaceutical products with pharmaceutical microbiology. So when we say spoilage and preservation of pharmaceutical products, we are actually talking about products made for pharmaceutical use. What spoils them? What are the agents of spoilage? And what are the effects of this spoilage? And how can this be prevented? So let's move on. What is a pharmaceutical product? Pharmaceutical product is any substance or mixture that is meant for humans. It's meant for humans. Any substance or mixture that is meant for human, for use. It could be for animals, but they are usually for the use of humans. And pharmaceutical companies are responsible for the production of these pharmaceutical products. These products are meant for whether diagnosis of disease, infection, or mitigation or prevention of a disease or symptom. When we say mitigation, kind of try to manage or preventing of a disease or symptoms, or diagnosis and treatments or of any abnormal physical or physiological states or symptoms, or for altering or modifying or correcting or restoring organic function. Basically, pharmaceutical products are meant for human and animal use. When we say pharmaceutical product, we are talking about products that are produced at a pharmaceutical company. They are specifically for human use. All pharmaceutical products are meant for human use or animal use, for living organism. So they are meant to treat disease, meant to eradicate symptoms, and so on and so forth. Contamination and spoilage. Now, before a product can be spoiled, the product have got to be contaminated. A product doesn't get spoiled, that is, a pharmaceutical product doesn't get spoiled unless it has been contaminated by organism. And so, contamination is the introduction of microorganisms into a pharmaceutical product. Now, this contamination may arise from different sources in the course of manufacturing. It can arise from various sources. We are still going to look at that. And when there is contamination of that product, this will in turn lead to the spoilage of such product. And when such product is spoiled, it will render it unfit for use. Apart from rendering it unfit for use, it may even be dangerous for consumption, because depending on the type of microbial contaminant, if it is a dangerous contaminant, then the introduction of that product which is contaminated will lead to complication of the health of the individual that is consuming that product. Reason for this is because when microorganisms contaminate a product, the purpose of them contaminating it is because there's no purpose. They don't have any purpose. But when they contaminate, the purpose of spoiling that product is for their own survival. Microorganism tries to utilize this product Let's go back to our former class on petroleum microbiology. I told you that so many organisms, they have the ability to colonize hydrocarbon products. And when they colonize this, they use it as their substrate and they break it down. And when they break it down, they remove it from the environment. We are happy about it, that they help us to break it down. But this time around, when they colonize pharmaceutical product, we are not happy about it. So the good and the bad side of the organism colonizing substances is what is displayed here now. So when microorganisms contaminate the pharmaceutical products, it is not a good thing. When they contaminate hydrocarbon in the environment, it is a good thing because their contamination of the hydrocarbon in the environment helps to break down the hydrocarbon and remove it from the environment. And we have a cleaner environment. But the contamination of pharmaceutical product is not a good thing because it's going to spoil the product, render it unfit for use, and may even lead to hazard depending on the nature of the contaminant in question. Therefore, microbial spoilage is defined as deterioration of pharmaceutical products by the contaminant microbe. That is, when microorganisms contaminate a product, it deteriorates it. The deterioration comes as a result of the microbial proliferation. They begin to metabolize, they begin to break down the substances. Now, if it is a drug with chemical structure with a functional group, once they destroy the functional group of that drug, then the drug remains impotent. It remains impotent. So spoilage is preceded by contamination, like I said earlier, and describe the process and consequence of microbial growth in products. So taking appropriate step for reducing the step to minimize the risk of spoilage is the responsibility of the formulating scientist or the manufacturer. That is, when we want to ensure that we take good steps to minimize risk of spoilage, because the truth is, so many products will get contaminated, but the rate of spoilage by contaminating organisms may differ. Some microorganisms has the ability to spoil, to cause deterioration faster than others. So those organisms that have high activity rates, their presence in such products may lead to serious harm because once they contaminate the product, give and take, in the next 1 week, the product is already spoiled. Whereas some organisms have a very slow rate of activity. When they contaminate such products, the product may even be consumed along with them and nothing will happen. So the risks in spoilage, to minimize these risks, is the sole responsibility of the scientist in charge or the manufacturer in charge. They are to take responsibility in ensuring there's a limited number of organisms that is contaminating the product. A spoiled product may be described as one that is unfit for use. That is, when a product is spoiled, it is unfit for use. It can no longer carry out, be used therapeutically because it begins to show many manifestations. It begins to show obvious signs. It becomes questionable. That is, the quality becomes questionable. Therapeutically, it becomes inactive because it is already spoiled. Some products can be defaced. Some products can give out offensive odor. Some products can have a color change. Some products can completely be changed. They could be solid product, then they could turn to liquid. Some can actually be semi-liquid. They can be jelly-like substances, but at the end of the day, they become a hard substances. The nature of the product can be changed because of the activity of the microorganism. So microbial spoilage are caused by bacteria, yeast, or fungi. Virus is not involved in this. Protozoa are usually not involved in this. Algae are usually not involved. The reason is because the environment determines the contaminants. Bacteria and fungi are easily involved because of the water activity and the adaptation to such environments. An organism such as algae may not grow because even though their spores may contaminate the environment, but then it becomes very, very difficult for them to survive in such environments where the drug or the product is made. The product itself may not be conducive for their growth. Bacteria and fungi in this category are extremely versatile in their metabolic activity since they can adapt to very broad range of environmental conditions. It makes it easy for them to contaminate and spoil the microbial product. The three reasons why microorganisms should be excluded from medicine, that is, to prevent them from spoiling products meant for human use. The three reasons is because product or raw materials contaminated with pathogenic organisms may be an infection hazard. Take it for instance, an organism such as Staphylococcus aureus, when it contaminates a product, it can lead to infection when consumed. This infection can actually complicate treatment in the process where an individual is actually being subject to treatment, therapeutic treatment with the same product. Or if a product is contaminated and is to be used on sterile body fluid, example are eye drops. Eye drops must not contain any bacteria. And when somebody is complaining of perhaps conjunctivitis or some disturbance in the eye and you are being given eye drop, the presence of another organism in that eye drops may worsen the situation. So it can be hazard. Number two is microorganisms may cause chemical or physical changes in the product and makes it to become less effective. Microorganisms can utilize the products and bring about changes, whether the chemical changes, the chemical component of the product may be altered. A functional group of the chemical product may be destroyed. The physical appearance of the product may be altered. A product may be a solid product and after microbial contamination may turn to liquid or jelly substances, while a liquid substances may become turbid substances and so on and so forth. And this can lead to impotency of the product. The third one is that microbial growth is likely to make the product unacceptable to the patient or the consumer. It may make the product to be likely unacceptable because the patient looks at the product you want to give, or the patient can be a buyer and looks at the products. Perhaps some of the carton has been infested with microbial colony, or the appearance, the color of the pharmaceutical product. For instance, if you are giving IV fluid, intravenous fluid that people call drips, if you are giving it to somebody and supposed to be pure, colorless intravenous fluids, and you see that this product is having a color change, it is your right to request that the products may not be used for you because you are not sure. So patients may reject such products with microbial growth. Consumer may even suffer infection risk because of contamination. Manifestation and mechanism of microbial spoilage. Before spoilage can occur, like I said, microorganism must first of all be introduced into the product, and this could come via different means. Introduction of microorganism into the product can be via the raw materials, because microorganisms that are capable of altering product must first of all be introduced. Indirectly inoculation, mostly indirectly. Nobody directly inoculates microorganisms in the product, because we know the end is going to be deterioration. So these inoculation are indirect inoculation, and this usually occur via raw materials. Via raw materials, some raw materials may be heavily contaminated with bacteria. So when they are heavily contaminated with bacteria, such raw material may culminate into contaminated finished products. We also have the processing plant. The processing plant is also a very good medium for harboring contaminants. The processing plant contains liquids and so many growth factors, nutrients available for microorganisms to sometimes ferment and release the product out, or the processing plant is a different plant with different purpose for the production of pharmaceutical products. Now, this processing plant must be sterile. It must not contain microbial biofilms. It must not contain holes that can allow penetration of microorganisms and so on and so forth. The processing plant is also an avenue of microbial contamination. Then the packaging materials, the cartons. There are some packaging materials that are attractive to microbial contamination, while some packaging material may repel. So packaging material that are used for packaging pharmaceutical products is critical in determining the rate of microbial contamination of products. The operative in the environments or inside the manufacturing room are also very important, because they can harbor microorganisms that can cause contamination. Although spoilage does not necessarily depend upon the growth of these contaminants, it is generally facilitated if the formulation and the ambient condition of the temperature and humidity encourage their multiplication. That is, if the environment is conducive for the growth of microorganisms, that is when the microorganism will grow and develop and spoil the product for us. After manifestation of mechanism of spoilage, you pause. Manifestation and mechanism of spoilage. Microbial spoilage can manifest themselves to the user in one of the following. When we talk about manifestation, when a product has been contaminated already. First one is the toxic effect. The toxic effects are microbial toxins that are produced by microorganisms which can produce toxic effects. Microbial toxins are released in the product, even though when the microorganism is already dead, their toxin remain, and majority of gram-negative bacteria are usually, majority of microorganism gram-negative bacteria involved in pollution, contamination, are known to be likely to produce toxin, and such include Escherichia coli, and they are very important in connection with injectable products, which is known as avenue for microbial toxin. So the toxic effect is actually dangerous because once they produce these toxins, it can affect the users, the consumer. So we also have metabolic products. Metabolic products from microorganisms that are already contaminated the products are catabolic products such as organic acids and amines, which are produced by microorganisms and they are toxic to man. You don't have to consume these substances, but these substances are metabolic products. When we say metabolic product, when microorganisms contaminate a product, the aim of the microorganism is to survive and utilize the product for its own growth. So in the process of their growth, they carry out metabolic processes and they release products. These products are toxic. They are different from production of toxins because production of toxins itself are endotoxins and exotoxins. But metabolic products are itself products of microbial activity. An example, like I said, is organic acids, which are naturally toxic to man. And although these compounds are considerably less toxic than the classical bacterial toxins, but when they are in high concentration in a product, they could result to illness, they could result to disease, they could result to kind of discomfort. So the manifestation in terms of metabolic product for microorganisms is undesiring. Some of them can produce what is actually useful for us, but in the form of metabolic product that they may not be useful directly. We may need to refine these products before use. That is why it is not good for us. Let's look at one more. Change of activity. The change of activity in terms of manifestation of spoilage is that these substances can alter the potency of the products. Change of activity is seen as a classical way of describing the penicillin drugs, which we talked about, beta-lactam drugs, which we said can be inactivated by beta-lactamase. So when a beta-lactamase producing bacteria colonizes a beta-lactam drugs, it produces enzymes which can inactivate this product, which is the drug of choice, and made it to become inactive. Some liquid formulation that contains microbial contaminants are seen to possess sediments. So supposing a customer, a consumer, a buyer looks at the product, which is supposed to give a crystal clear view, is having sediments because the microorganism has started, altering the product. Then the product becomes unfit for sale or for consumption. Or some product that's supposed to give a clear view is becoming turbid. You now discover that you can't see clearly on this product. Then you are scared. When the product is naturally supposed to be turbid, the product is supposed to be naturally turbid, but the product is now clear, then you begin to wonder, what is the purpose? What is the problem? So change of activity by microorganism is another manifestation of mechanism of spoilage that is observed during contamination by microorganisms. I will stop now and we will answer questions because I don't want this recording to go too far because of the size of the recording. Thank you.